My name is Dr. Richard Fessler. I went to the University of Michigan for my undergraduate and medical school education. I was in a 6-year program which combined both together. I graduated from that program in 1987. In addition to my fellowship training in endovascular surgery, I also trained in Japan with one of the foremost cerebrovascular neurosurgeons in the world at the time, Dr. Kenichiro Sugita. I entered practice in 1995 after completing my neurosurgical residency training at Wayne State University. I was actually in practice for 3 years, and I decided that I needed to acquire an additional skill set in order to take care of my patients the way that I wanted to. I actually closed my practice for 2 years and trained at the State University of New York in Buffalo in neuroendovascular surgery. My specialty is about taking care of complex vascular problems in a minimally invasive way. The most common thing that we do that people recognize is what's called coiling of aneurysms. And this is something that we do again through a minimally invasive incision that's usually only 2 or 3 millimeters. Sometimes we do it from the leg, occasionally we do it from the wrist, and we're actually able to go from a small artery up into the brain. We put a small catheter within the aneurysm, and then we fill the aneurysm with coils, much like Russian tea boxes, where one box nests inside the other. That's how we rebuild an aneurysm and make it go away. We put in a coil that just fills the inside, and then we keep putting in smaller and smaller coils until we can't get any more in. Most of the patients who have that procedure done are in the hospital about 20 hours. They go home the next day, and 99% have returned to their normal activities of daily living, we call it, within a week. I'm a general neurosurgeon by training. I have my additional training, but I also perform cervical and lumbar spine surgery as well as tumors of the spine. Well, I've developed actually 3 or 4 stroke systems of care. Our first was called the Michigan Stroke Network, and that was a 35 hospital telemedicine network where we actually delivered a specialist through a telemedicine connection directly to a patient's point of access. So no matter where they were, as long as they were within one of our affiliated hospitals, we could deliver a stroke specialist to their bedside within minutes. Since I've moved on, I'm now the lead physician for Ascension Health in the state of Michigan and their telemedicine program. And we have a similar but much more robust program that includes stroke, trauma, neurology, as well as behavioral medicine. I see telemedicine going wherever our smartphones go. I think that audio-visual communication is very much a part of everyone's life every day. And I think medicine has been a little bit slow to actually take part. My kids, their friends, my relatives, my parents, they all communicate over devices, whether it be a smartphone or an iPad. I think that medicine will be very much the same way. I think over the next 10 years, we're going to communicate, track our health, and we're going to do that by interacting with our devices and our smartphones.